Works. Okay, great. So, hi everyone. My name is Arlana Henry. I am a fourth year doctoral student in the School of Criminal Justice at Rutgers Newark. And the title of my talk is actually a bit different than what's posted on the schedule for today. The new title is The Spatial Distribution of Non-Fatal Firearm Injury in the City of Newark. And there was a slight change due to availability of data. And so I shifted what I was going to be analyzing for this study. So just to start, as many of you already know, and definitely probably learned from the other sessions today, there are over 71,000 non-fatal gunshot injuries in the United States. And there has been broadly increases in all categories of gun violence related to homicides, domestic violence, suicides, school shootings, and mass shootings over the last couple of years. As of May 1st, there were approximately 14,000 people that have died from gun violence in the United States this year alone. Recent research from the Centers for Disease Control and Prevention has found that firearm homicide and firearm-related suicide have both increased from 2019 to 2020, and that the firearm homicide rate was the highest recorded in over 25 years. With specific regards to non-fatal injuries, research has consistently shown that most of the individuals who are injured by gun violence, they actually end up surviving, and that non-fatal firearm injury cases are twice as prevalent as deaths from firearms. Specifically, with regards to African Americans, Black individuals living in urban settings, research has shown that risk for firearm victimization is most significant for this population, and that there were, in 2019, approximately 40,000 firearm-related deaths, and homicides were greatest among African American men ages 20 and 40 years of age. Black men in particular have the highest rates of firearm-related hospitalizations. And so why does this matter, right? Primarily because of the last point, that the risks are greatest for young men of color, primarily those living in urban settings. But more importantly, research has found that victim survival from firearm-related injuries is often contingent upon the speed and quality of care that's provided to individuals who are victims of gun violence, and that victims who are shot farther away from trauma centers have an increased likelihood of death. So I'm really interested in understanding the spatial distribution of non-fatal firearm injuries, primarily because that is an area that most people don't necessarily tend to focus on. Most of the emphasis is usually on fatalities, which is understandable, but I'm very much interested in learning more about survivors, right? So for this study in particular, I'm going to be assessing the spatial distribution of non-fatal firearm injuries in the city of Newark. And then I'm also going to be assessing the characteristics of blocks or census tracts with non-fatal firearm incidents in Newark, to assess whether or not where these incidents are happening, and whether or not they're happening within close proximity to hospitals and trauma centers. The data that I'm going to be using consists of 3 different data sets. The first is GeoWeb data from the New Jersey Department of Environmental Protection, Bureau of GIS, to locate and identify neighborhoods, hospitals, and trauma centers in New Jersey during the study period from 2020 to 2021. And then I also have de-identified incident level gun violence data, which includes only hit incidents, as well as robbery hit incidents between 2020 and 2021, which was provided to me by the Newark Public Safety Collaborative, which is housed in the School of Criminal Justice at Rutgers Newark. And then I have national census data from the U.S. Census Bureau. So in terms of background, so Newark, if you're not familiar, Newark is divided into 5 different wards. You have East Ward neighborhoods, North Ward neighborhoods, Central Ward neighborhoods, South Ward neighborhoods, and then West Ward neighborhoods. Each of these neighborhoods have distinct, each of these wards have distinct neighborhoods within them. And they have different residential developments and different makeups. In Newark specifically, there is only one level 1 trauma center in the region. I should say in New Jersey, in the northern region of New Jersey specifically. There's only one level 1 trauma center, which is the University Hospital, which is located essentially in the central ward. Just to know, it's possible that individuals who are victims of firearm violence can be sent to other hospitals, either by ambulance or by, let's say, a family member or friend who at the time of the incident decides to transport them to someplace else, but more than likely they would be taken to the university hospital. Let me just do a quick time check. I think I have like 5 minutes left. So you all can't see it, so I'll just talk through my preliminary findings. But what I have laid out is maps of Newark with boundaries for the different wards and the points for all of the firearm incidents for 2020, and then I also have maps for 2021. And so essentially what the maps look like, and let me see if I can try to share one last time. Let me see if the sharing gods are with me, or maybe not. Let's see. Let's try this. No PowerPoint. Proximity. No, not that one. This one, no. Okay, they're not with me. Nonetheless, so my maps look like are basically outlines of Newark and the different wards, and then you'll see points for all of the incidents for 2020 and 2021. So I will say in 2020, there were 170 non-fatal hit incidents that occurred various points throughout the year and at various different time points. And so just looking at the map, a lot of the incidents happened in central Newark and then Central Ward and the South Ward. And then you had some in the West Ward, whereas the East Ward, there were only about 8 to 10 incidents. And the map for 2021 essentially looked the same. The only difference was that in 2021, there were far more non-fatal hit incidents. So there were 213 relative to the 187 that existed in 2020. So the non-fatal hit incidents increased during that time period. But the layout is essentially the same in terms of where the incidents occurred, right? In the central area, in the west area, and then in the south ward. Sorry, not area, but ward. The northern ward had a few more firearm hit incidents, and the east stayed again relatively bare with the same maybe 8 to 10 hit incidents. But it's also important to note that in the eastern area, there aren't as many block or census tracts or group areas. Neighborhood census tracts or blocks in that area because it's largely industrial. So it's slightly difficult to see. Something else that I had on here that I was going to show is that the number of incidents spiked, which is consistent with prior research during the summer months. So there were in July approximately 30 different hit incidents relative to January, early in the year of 2020, which also coincided with the pandemic. So January to March 2020 didn't have as many incidents as the second and third quarter of the year. But in 2021, there were far more incidents between April and September of hit incidents. And there were some spikes in February and July. What else can I talk through with you all through here? I already mentioned this, the time points. The incidents happen at various points, various time points in the day on the various dates. And let me see what else I have on here that I could talk through. I'll stop there because I think I have like a minute left and I do want to leave time for questions. So next steps, I'm hoping to really assess the spatial distribution by census tracts more specifically. So there are almost 8,000 block groups in Essex County. I'm going to narrow that down and look at Newark specifically to see how many block groups exist. And then I'm also going to work on assessing the average time across incidents and look for variations across race, gender, ethnicity, income, and educational background using the census data. And I think that's it for now because I think I have like 30 seconds left. So sorry for the technical difficulties, and I do appreciate you all for joining in. And again, if you have any questions, just let me know, or you can ask them now or put them in the chat box. And if you're interested in seeing any of the maps that I created, you could also email me and then we can continue the conversation. Thank you. Wait, oh, the chat box has stuff. Sorry. Awesome. Thank you, Frank. Does anyone have any questions before we, I guess, move on to the next session? Move over to the next session? Sorry. Thank you. Sorry. It's not my tech day, right? So what I was saying was that my original plan or my original desire was to look at include ambulatory data to look at time to hospital based on what how long the ambulance took to get to the university hospital. And so I wasn't able to get access to that data yet, and so I'm hoping to be able to include the ambulatory data. However, I didn't necessarily think about police. I was more so thinking about the ambulance. So yes, yes and no. Not necessarily the comparison of police versus EMS, but looking at EMS to see if that impacted lethality. That was hence the reason my original title. So, sorry about that. But that is actually a very interesting point or question. I'll write that down. Interesting. Philly soups and scoops and caps cars. Okay. Thank you for that. I'll definitely look into it.